7:44 the time. Welcome back. This month is Mental Health Awareness Month, which is why we do want to remind people of the importance of dealing with stress and treating mental health disorders. There are a number of healthful ways to cope with these issues. Also, a number of resources available in the New Orleans metro area for those who do need help. Joining me now to discuss these methods is Dione Joseph Breckenridge, a behavioral health clinician manager at DePaul Community Health. Good morning to you.
Good morning.
You know, we often hear if someone's going through something, they may say, oh, my nerves are bad, and then, you know, maybe do something in silence or not really address what may be something more serious than simply bad nerves.
And that's correct. We can definitely provide services at DePaul Community Health Centers. We have 8 locations out of our 11 that provides behavioral health services. Those services, talking to someone is very important. Mm-hmm. In the terms of taking care of yourself. It's not good to just let things go.
So if you are dealing with a situation where you're stressed and it just doesn't feel right, what are some signs that you think could help you to determine that you should go talk to someone?
Sometimes there's just a lack of a feeling of hopelessness. Mm-hmm. Not taking care of hygiene, losing weight, becoming withdrawn, things like that. Say, okay, I need some help. And friends should notice. If a friend notices, then it can encourage someone to go and seek care.
And that's a common position to be in, feeling as if you can't go on, or you're stressed, or you're not wanting to do everyday things because you may be in the midst of a depressive moment. Is it rough getting over the stigma of what it may seem like speaking to someone?
Sometimes it is. I think that now we provide school-based health care services, behavioral health services in 22 area schools, and also at Delgado Community College and Dillard University. And I think that helping our children gain access to services in the schools will help their parents feel better about seeking care and it be not a stigma about it. Because most of the students, they're like, oh, that's my counselor, and when I see them in the street and stuff and I say, well, I'm not going to speak to you, they'll be like, oh, that's my counselor. So they make it easier, it makes it easier.
Let's talk more about the program you have in area schools. How many schools again?
So it's 22 schools, in public and private. We have a clinical mental health services person at each school. And
this is different than a guidance counselor.
It's different than a guidance counselor. It's actual services for anxiety, depression, grief, just a variety of things. And this provides access where parents don't have to leave work to pick up the child, to take the child to their appointment. The child misses less class time because they're not getting checked out of school. Important. It's just a short amount of time. So it's good for everyone. Parents don't have to worry, oh, I have to leave work, because everybody can't have an after-school appointment, right? So we provide those services in schools. And we also have it in 8 of our 11 clinics.
Okay. A lot of good work going on there. We do thank you for coming in and offering some insight to a very serious concern here for many, and ways to really go out there and get the help that's available.
Thank you. And if anyone needs services, they can call DePaul at 504-207-3060 or DePaulCommunityHealthCenters.org.
All right, and of course, if you do want to get that help, go to our website and we'll link you to where you need to be there, and the number that we do have on your screen, just set it there, 504-207-3060.